G'day, I'm Dr. Leader Clifford, and today I'll be talking you through the management and bandage application of a traumatic wound sustained over the knee of this 4-year-old thoroughbred gelding. As you can see here, it's directly over the top of the carpal joints, and unfortunately a large section of skin was removed at the time of the incident, enabling us to really only being able to manage this wound through second intention healing and not being able to close it through primary apposition. So prior to recording this video, the wound was cleansed with sterile physiological saline, as I tend to avoid the use of antiseptics after about 3 days. And so what we'll do now is I'll show you how to apply a bandage using the Manuka Vet pure sterile honey. And what I've pre-made was a 10 by 10 centimetre absorbent pad, which will act as the primary layer on this wound, with roughly 30 mils of the honey applied to that contact layer. We'll then secure this to the limb using a thin layer of cotton wool, and we apply the contact layer directly over the top, ensuring the whole wound is covered, and then using this sterile cotton wool to apply it to the limb. The purpose of this thin cotton wool layer is to, one, allow the primary contact layer to be opposed to the wound appropriately, and to make sure it doesn't slip when applying the second layer, and also to reduce the chance of a tendon bow on the back here when applying the bandage. So next, we'll grab our layer of reinforced cotton wool, also called gamgee. We then apply that over the wound. And then to secure this in place, we use a tertiary layer, in which case is a vet wrap. Always making sure we pull the bandaging material around to the medial aspect of the limb, and ensuring we get a 50-50 overlap with the vet wrap. And also making sure that we leave a section of the secondary layer at the bottom without pressure opposed on it, as if you go over this you can cause pressure wounds on the skin. Once that's complete, we then take a section of adhesive bandage, which we then lay around the top and the bottom. And this reduces contamination of the bandage from any foreign material whilst in the stable. And one final thing we need to do is make a small incision through the tertiary and secondary layers